Thank you very much. Yeah, I can see we are. Recording and transcripts have started. That's great. So thanks, everybody. Welcome back after just a 5-minute break there to grab a cup of tea and continue with our work. So we've just got a couple more items to finish on quality, haven't we? We're going to hear from Karen what she would wish us to know regarding the COVID-19 vaccination programme, and then we'll turn to Mark, who is seeking approval on 3 recommendations relating to national standards of healthcare cleanliness. So, Karen, shall I turn to you first, please, for anything you would wish to bring to our attention regarding the vaccination programme at the moment, please?
I will be very brief. We're moving into a business as usual phase in the vaccination programme. So at place level, we still offer the evergreen offer for first, second booster injections, plus catch up with boosters. But at the moment, the focus is on healthy 5 to 11-year-olds. And also looking at the spring offer, going back into care homes and vaccinating in care homes. We are also planning from autumn to be able to respond to a wider booster vaccination programme that is likely to be 50s and over, including health and care social workers. The planning is going on at place, very much part of our Actors 1 and using our Actors 1 principles. From a BTHFT point of view, we remain as the lead provider, and with that, the lead employer for anyone that's been brought into the vaccination programme, including volunteers and temporary staff. The only exception to that is Airedale, who maintain their own staff bank. So going forward and in preparation for autumn, it is likely that Moderna will be used more. From a BTHFT point of view, we are only assured to give the Pfizer, and the other one that name has gone on me, but we are not assured for Moderna vaccine at the moment, and we will be going through that assurance process over the next few months. I will pause there for any specific questions, but we're in the middle of a round of national planning feeding into West Yorkshire and the wider region on this at the moment.
Thank you, Karen. Thank you very much, and thank you for your continued leadership in this area on our behalf. And Sugra, we note the excellent personal experience that you had coming in for the job. Thank you very much for noting that. John, would you like to come in, please?
A couple of quick points, if I may, Max, please. I'd like to just reinforce what Sugra said. I had the pleasure of coming into Bradford for all 3 of my jabs, and the service was absolutely fantastic, both in terms of information and customer patient care. But I'm also taking part in the Moderna research project that Karen's just alluded to. It's very much at its early stages, but I've been accepted onto the programme, and the quality of the interaction with the research staff, which I think the Bradford University staff, I may have that wrong, has been absolutely fantastic, Max. And someone's got to do it. It's really been easy to participate in, and the staff have been wonderful. Thank you.
Well said, John. Thank you. It's nice to endorse great practice when we see it as well. So thank you for that. Good point. Mel, would you like to come in, please?
Just on that point, I think they probably are our staff. We use the university facilities as our patient recruitment centre oftentimes, but it's often our own staff, which is great to hear. Great feedback. Thanks, John.
Yeah. No, thank you, Mel. Yeah, it's great. And it's obviously noted as well, John. Thank you for that. Yeah. So there's nothing further on Karen's excellent work with the COVID vaccination programme. I'll move on then. Thank you to Mark, and ask him just to bring to our attention the points of the new national standards of healthcare cleanliness that he would wish us to consider. And we have the paper, of course, Mark, with the 3 recommendations at the end of those. So I'll turn to you, Mark. Thank you.
Thanks, Chair, and hi, everybody. So the paper I'm going to take as read, but let me just give you a little bit of background and context on what I'm seeking here. So a mandated requirement of the new National Standards of Healthcare Cleanliness require for all trust boards to approve what's called a Cleanliness Charter. So the new national cleaning standards that are going to be introduced in May are a complete overhaul of what we've been doing for around the last 14 years. So the facilities team have been gearing up to implement them, and this paper effectively is me bringing this to you today for our board to approve the Cleanliness Charter itself, which you'll see is in Appendix 1. So effectively, that's what I'm asking to be approved, the Cleanliness Charter in Appendix 1. But this Cleanliness Charter is effectively an expectation for us to commit to the Cleanliness Charter, which sets out our organisational commitment to achieve a consistently high standard of cleanliness. It's to show and demonstrate that we're serious about providing a safe, clean environment by referencing key elements of delivery and maintaining a high standard of cleanliness, of course. And we're required to display the charter, the Appendix 1 charter, at all ward entrances and circulation areas. So we're going to see kind of visually as you walk around the hospital, these up in all areas, along with what's already actually being put on our wards now, because as Bradford Teaching Hospitals facilities, we were one of the early pilot schemes that helped support the new National Planners of Steadiness when they were written around 18 months ago. So we are a little bit ahead of the game, and we've even now got what is now a 5-star rating, very similar to the local authorities' food hygiene standard rating scheme. So we've just actually put those on wards. So this complements that. But this further explains fixed criteria for each area associated with cleaning tasks, frequencies and responsibilities. And again, you'll see those in Appendix 1. So this draft commitment chart has been produced and approved already by the Cleanliness Working Group, nursing colleagues, and it's gone to the IPC committee. So the board are asked to acknowledge the work done to date, firstly, accept opportunity for further reports as necessary on the national cleaning standards, but ultimately, and what I'm seeking for us today is to approve the commitment to Cleanliness Charter, as I keep referring to in Appendix 1. So we need to sign this off to be able to put it up on our walls.
Thank you very much indeed, Mark. Mark, can I just check with you as Director of Estate and Facilities, do we endorse and accept the national standards in full? And I'm just wondering whether do they present us with any local particular challenge?
They don't, Chair. So from our perspective, we're comfortable with the new national standards of healthcare cleanliness. We've reviewed them. We've done all the requirements that are things around a gap assessment, the responsibility matrix, increased audits. We've set up a multidisciplinary team, setting out new SOPs and policies. So there's nothing that I need to flag as Director of Estate Facilities. We're comfortable, we're happy. We need to approve the Cleanliness Charter, and ultimately I need to migrate the teams to enacting the new requirements. And you'll see on the charter, it actually talks now in a lot of detail more, you know, it's very visible around cleaning tasks, cleaning frequencies and responsibility areas. So it's all there, and we can achieve those. So yeah, I've got no issues with it.
No, thank you very much, Mark, and I'm delighted to hear the visibility around the trust of that charter, which clearly is in keeping with the transparent organisation we want to be. So great stuff. John, would you like to come in, please?
Thanks. Yeah, thanks, Mark. Obviously, fully supportive of this. It's a wider comms issue, so you may have to take this away. You may not know the answer. In terms of putting the charter up on the wall, that's great. I just wondered what we were doing about communicating it to people whose first language isn't English or people who can't see, read or understand, because I think there's just an issue about patient confidence here, isn't there, that we need to make sure we share somehow. Not sure I know the answer, I just know the question as usual. Thank you.
Good question.
No, absolutely, John, and it's a fair point. So we have already realised that, and of course, you know, I think we need to take a sensible, pragmatic approach. We couldn't, you know, these are A3 documents that need visually putting on in a frame, you know, on the walls, you know, and we've not got enough space, and it would be crazy of us to put, you know, 7 or 8 different frames. But we can't do that. But what we can do, I think, is have a reference to a referred document that will be done in a range of different languages. So I think, you know, people that will want to understand what one is and actually translate that and look in more detail will still have the access and ability to do it. So we will have some kind of, you know, signposting to where that's available, and people will be able to do that.
Thank you, Mark. John, are you satisfied with Mark's detail there? Yeah.
Yeah, it makes eminent sense, Max, and I wasn't suggesting, I'm sure Mark wasn't suggesting I was it in 7 languages. But I have just put in the chat whether we can think of something easy read that just gives the message somewhere in there. I'm not suggesting everywhere, but that might be another alternative as well. Thank you.
Yeah, no, good for you, John. Equality of access, well said. And yeah, we've certainly noted that. Mark's clearly got that on his mind as well. So thank you, John. Yeah, Mark, our non-exec director, Sugra, just asks whether, does A&E present any particular cleanliness issues, given I mean, Mel briefed us earlier today that you've got something like 400 people attending at A&E daily. So she's just wondering whether, does that kind of present a bit of a challenge in that area, and whether spot checks are maybe done out of hours?
It does, and I think it's fair to say what it presents is happening right here, right now. So, you know, that is happening now, and we have had to enhance cleaning and re-look at the cleaning cut. So, for example, the current cleaning standards identify very high, medium and low risk areas, and of course A&E is very high, and we've put the right amount of resource hours in, and we've had to change and adopt that to fit when you can get in, how we can work around clinical colleagues to make sure that we're meeting those standards. And we are achieving over 98% cleanliness in A&E, which is fantastic. And I think the important thing with these new standards is it actually recuts, if you want, the risk areas and categories. So it looks at more enhanced cleaning in some of the very high risk areas, and actually it takes off some cleaning elements in really low risk areas, and it rightly does so, because office space doesn't need that level of cleaning, of course. So it really reshuffles that deck of cards and refocuses cleaning where it needs to be. And the gap assessment I referred to earlier is a piece of where we're actually looking at all our risk category areas, and those have already been agreed with IPC and nursing colleagues. So we know what we need to do and where we need to do it. We're just reshuffling things around to make sure we can absolutely put that resource in those areas at those levels to achieve 5-star cleanliness ratings. So you can be assured.
Thank you, Mark. And Sugra, I can see he's nodding, so that's great. That's providing the information required. Thank you, Mark. Okay, colleagues, are we content to acknowledge the work being undertaken, to endorse the fact that we'll get updated status reports, and to approve the draft commitment to Cleanliness Charter template, subject to those discussions about equality of access, etc., which was great. And Karen, I noted your point in the chat as well, that you'd be happy to work on that as well. So great stuff. I had QR codes in mind, so I don't know whether that's ever possible, but that's probably all the good work that we're seeing done, isn't it? And Karen's nodding. Maybe that's a chance, yeah. Okay, but this is good stuff, and I think there is unanimous support across the board for us being the cleanest organisation we can, and for endorsing that work. So, Mark, thank you for bringing to our attention the key points of it. Great stuff. Okay. Shall we move to people then? And I'll turn to Karen. As always, we begin with the chair of the People Academy, who will be referring particularly to 2 reports, January and February's Academy work, but just general issues that she would wish to bring to our attention in people. So, Karen, shall I turn to you first, please?
Thanks, Max. And it seems like a long time ago that we were talking about January. It's just been quite a quarter, hasn't it? So January, the biggest focus was on absence. So I'll give the headlines. And obviously Omicron gave significant pressure throughout January. And with that in mind, like the Quality Academy, we agreed to hold a briefing session with a very limited audience. And what we did was focus on absence, because we'd already agreed we'd do a deep dive on that. We were concerned at the increase in levels, and Omicron obviously worse than that as well. So actually, towards the end of January, we had 260 people absent across the trust, and 130 people on maternity leave. So you can imagine the impact of that absence. The peak wasn't as high as it was at the start of the pandemic, but actually what we noticed with Omicron was it was taking a lot longer to tail off. Carers leave impacted as well, because this time around we saw children sick with COVID. And December absence was at 7.45%, with year to date at 6.42. And then in January that rose to 9.69% and year to date 6.66. And there were increases across the board except pharmacy. Registered nurse absence was at 8%, and our HCAs had the highest rates overall. And when we looked at that, it was around age profile, demanding workloads, pre-existing medical conditions and other things. So we took a look at year-to-date absence as well. It hasn't been below 6% for the last 12 months. Previously, we teetered below 5%, but there is a step change in the absence profile overall. And long-term absence is coming down, but that short-term absence is increasing. And the big jump we saw was particularly November, December, January, in line with Omicron. How we manage I say we as a trust, how we manage short-term absence has changed as well. So with the pressures on everybody, ER work was paused because they were doing other activity. Absence management paused as well because managers were under pressure with different activities, but also there was absence through the management population. And staff had been redeployed to other wards as well, so they were being managed by different line managers. So lots and lots of different impacts across the piece. There was also a self-certification issue. So self-cert was increased to 28 days from 7 days between the 17th of December and the 26th of January, and that freed up capacity for GPs to focus on the booster programme and emergency care as well. Absence reasons were very similar to how they have been over the last couple of years. So anxiety, stress, depression, psychiatric, mental health kind of issues as number one, infectious disease as number two, and then other known causes. Absence longer in duration as people were waiting for medical interventions themselves, such as surgery, and all of that was delayed as well because of Omicron. The Trust are reviewing the managing attendance policy and also the Bradford score, so the number of instances of absence squared and the total number of days in a year's period, and the related admin burden that brings, and that's going to get reviewed over the next couple of months. The main risk was staffing. It remains challenging, particularly across nursing and midwifery because of absence and also the number of vacancies. So there was some realignment of wards and a safer staffing review, and that created 169 additional vacancies across nursing and HCA posts, in addition to existing vacancies as well. And then when we looked at the risks overall, people experience, so the experience of coming to work, people under pressure, redeployed, not necessarily doing the same job as they were previously, patients and families more anxious, less tolerant, patient experience because of less staff, increased anxiety, longer stays, and safety overall. So we were assured that we were safe, but the red lines that we wouldn't ever want to cross were nearing throughout that period. But lots and lots of activity to support looking after our people, focused around wellbeing conversations, OC health support, mental health support, physical activity, flexible working, civility in the workplace, reward and recognition, rest breaks, annual leave, and staff facilities. So an awful lot going on to try and mitigate some of the issues. And then when we turned to February, we focused mainly on assurance, partly because we had a shorter session in January, but also this month in March, we will focus more on learning and improvement. We focused on particularly health and wellbeing. So that area of the dashboard has been downgraded to red due to increased sickness, absence, and also the low take-up of flu vaccines. Appraisal rates have been impacted as well across all areas because of a pause of activity due to the significant pressures on service. COVID-related absence impacted bank and agency staff as well, and we saw a slight increase in staff turnover from 12.31 in December to 12.39 in January, and there is a similar picture across the Wyatt area. Main risks, again, poor experience of people during sustained pressure, potential lack of capacity to manage increased caseload for children, optimal staffing levels in maternity services impacted due to vacancies, COVID isolation rules and sickness levels as well. And I've mentioned the flu vaccine, the take-up at the end of January is 53.3, so low, but the Trust did make a strategic decision to prioritise COVID. Same time last year, it was at around 82%. The U-turn on VCOD we've already talked about, as Mel said, consultation closed 16th of Feb, and parliamentary vote was expected last week, but that's been delayed. And the trust is still encouraging people to sign up for that. And we believe that 96% of people have had the first vaccine across the trust. And glad to say that as at the 22nd of February, COVID-related absence had reduced to 76 from the 260 at the end of January. So we did see that starting to come down. And actually, there was a lot of good news that we talked about in February as well. We've got 295 colleagues on apprenticeship programmes across the trust, focused on a nursing recruitment and a retention plan. There's been funding given for a 2-year deal with an external marketing company to help attraction, funding for 50 additional nurses through international recruitment, collaboration with the University of Bradford on recruitment and retention. Induction of overseas nurses into theatres was seen as exemplary, and therefore that will be a gold standard for us moving forward. And funding's been received for a new 12-month post for a People Promise Manager as one of 30 trusts throughout the UK that's classed as a People Promise exemplary site. So some really great news there. Nhs Planning Guidance has been received with a focus on 4 quadrants of the people plan. So looking after our people, improving belonging, working differently and growing for the future. And the first draft has been submitted to Bradford Place at the end of February, and the final submission needs to go by the end of April. And the focus very much for the next 12 months is around sickness absence, turnover, current and planned establishment, and addressing those staffing issues and introducing new roles where required. And I think I'll just say a final word. In the week of International Women's Day, it's really important we talk about gender equality. And we heard at the February session about a belonging update around gender pay gap. The report was published or will be published by the end of this month. And the last report was done in March 20. So there has been a lot of improvement. Mean average and median average pay and bonus gaps have reduced. Women in upper quartile, higher paid staff roles has increased. Increase is seen in women in medical and dental roles, and an increase seen in men and admin. An increase of men in admin and clerical roles as well. And there is further work to do, obviously. The underrepresentation of women at more senior levels, overrepresentation of men as well. Underrepresentation of men in nursing and midwifery, admin, clerical, allied health professional roles as well. Lots of work to try and identify and attract men into nursing roles, and we're working with the University of Bradford on that. Promoting gender equality generally across the trust. And lastly, yesterday, the EDI team organised a fantastic event, Women in Senior Leadership, as part of International Women's Day, to share insight and reflections on navigating careers and overcoming barriers. And we had a brilliant panel. Mel, Karen, Rakea Mia and Abimbola Olusoga joined as well. And it was just a really inspiring day with complete honesty around how these people had overcome adversity to get to where they are today. So lots more to do overall, but an awful lot of work going on across the trust to make a difference as well. And I'll leave it there.
Great stuff, Karen. Thank you very much indeed, and well done to you and the team for the work on International Women's Day that took place yesterday. That's great to hear the event went so well. Thank you, Karen. And thank you for your focus on absence and well-being and the analysis that you shared there with directors. That was extremely useful, so thank you. And what I'll do, I know I will open up for questions, of course, but just a heads up to Pat that I think I'll come to you, Pat, and just ask whether there's anything further from the academies, and maybe the issue of the verbal report that you give us on looking after our people, given that it's clearly been a subject of January and February's work. But I'll open up for questions now and then turn to Pat. I'll, of course, then come back to the item 13. Okay, so John, would you like to come in first, please? And then Paul, if you wish to. So, John.
Yeah, just a couple of points, Max, if I may, please. I think I'm chairing the People Academy in March, Karen, so I will try and live up to that excellent briefing. Well done. I'm sure I'll fail, but it was an excellent briefing, so it sets the standard. Thank you. I will pay attention. It was really just to make a comment on the gender equality stuff that I was really impressed with the progress we've made. This stuff doesn't happen by accident, and I think there's absolutely no complacency either, that we all know there's still challenges ahead around the culture, around some of our representation, but we are making some really good progress. And I just want to thank the staff who lead on this, Mel, Pat, Kez. I'm sure I miss loads of people, but whoever thinks they have a significant role to play in this, please accept my thanks, because it's great progress, I think. So it was a comment, Max, not a question. Thank you.
Well said. No. Well said, John. I can see colleagues nodding as to the importance of getting that right. So well said, John, and thank you. And the thanks to the team is noted as well. So well said. Paul, shall I bring you in, please?
Thanks, Mike, and mine's a comment as well. I just wanted to thank Mel for her positive role modelling at a personal level. One of my youngest daughters spent a little bit of time with her in the half-term week, and for a whole host of reasons in relation to the sort of leader that Mel represents, it was really important for her. So I just wanted to specifically make the board aware of that and thank Mel for her positive role modelling.
Well said, Paul. Thank you. And I can see Mel's nodding in appreciation. So thank you for noting that. That's great. So in the absence of further questions, I'll turn to Pat, just see if there's anything further from the academies that Pat would wish to raise with us, and perhaps just advise us if there's anything looking after our people-wise that is worth us knowing, Pat. So Mike's with you, Pat.
Sure, thanks, Max. So just following on from what Karen said around sickness absence, when we've actually done a review of the last 2 years, January 2022 was actually our highest monthly sickness absence when we look at the whole duration of the pandemic. So that sort of puts into context the issues we had around our staffing pressures, the escalated risks around available workforce in January. And that was obviously reflected in terms of what we saw. Pleased to say that sickness has started to drop in February. Like COVID sickness has dramatically dropped, and short-term sickness for virtually all staff groups and CBU saw a dramatic increase in January, has dipped again. Obviously, in terms of impact on month-on-month rates, that will actually be slower to improve. The other thing just to add is around VCARD. So obviously legislation has been repealed from the 15th of March. As Mel said, we continue to encourage staff to be vaccinated. We are seeing some pickup on staff vaccination rates. So I think, as Karen said, 96% of our total workforce have had a first vaccination, and we've also got an improved second vaccination rate, which has increased to 92%. So obviously we continue to offer a vaccine to our staff. In terms of sort of moving on to looking after our people, obviously our wellbeing offers all remain in place as previously reported. I think both sort of Kay through the neonatal presentation, and Sarah and Carolyn through the maternity presentation gave really good examples about on how we were looking after our people at a local level and a service level. In terms of other things we're doing, obviously we have talked about the impact on our Ukrainian staff. So we have put out specific messages of support both locally and nationally in terms of the offers of support that are available to them. In terms of the impact of staff sort of working additional hours, and if that is impacting on our sickness rates, we have revised our return to work interview form so that there's particular questions asked around if staff are working additional hours on bank or agency, how many hours they're working, what the impact on that is, etc. So we can get a good view in terms of well-being. We are continually updating our Thrive website with the support offer that is available. There's a very detailed offer around emotional well-being. So a whole section on emotional well-being resources that are available, a whole section on physical well-being resources that are available. And again, with the focus on International Women's Day this week, we've sort of published a wide range of new resources on the menopause. So we've got sort of a new manager's guide, we've got a support network set up for women. And we've also been running some wellbeing sessions, particularly focused on menopause, both locally and as part of the Health and Care Partnership. We have restarted appraisals again in February, and wellbeing is the first area on the sort of appraisal form that we ask sort of managers to focus on. And then I think the last thing really to say, there is a national session set up for wellbeing guardians, which has been arranged at the end of March, which is around sort of looking back, looking forward, sharing good practice, etc., which obviously we will be feeding into. So that's just a short update really in terms of where we are.
Yeah, no, that's absolutely great, Pat. Thank you for the excellent briefing, the examples of the ways in which we're embracing the national priority of looking after our workforce so that we can look after people. So thank you very much, Pat, and Karen too, for the quality of the briefing you gave there. Thank you. Janet, shall I come to you, please?
Thank you very much. I was just interested, Pat, if there's any implications for staff or students from various universities in terms of placements or their employment if they're not vaccinated going forward.
So Janet, it's a very good point, and I may know better this afternoon, because there is a session, there is a national session focusing on what happens now. So in terms of the briefing from the consultation, they were silent on what happens to new recruits. So we originally thought it was that meant we could take our own decisions. There was subsequently a message came out nationally to say that NHS employers were being asked to update the NHS employment check standards in the light of the sort of repeal of the legislation, and we're not sure from an HR perspective what that means. So to say, there is actually a national FECOD meeting at 3 o'clock this afternoon, so I'm happy to send a sort of post-meeting note or a short briefing round if that would be helpful.
Yeah, very helpful insight of what it means for current new staff and students. Yeah.
Yeah, no, great point, Janet. And Pat, thank you for your commitment to just perhaps drop a note as an update on that point. Yeah, so that's really helpful. Thank you. Thanks. In the absence of any further questions, are we content to have noted the chair's reports from people? Extremely useful. Thank you very much indeed, and for looking after our people, which we're absolutely committed to. I'll just return you to item 13, which is the Strategic Equality and Diversity Council update. And of course, in that, Mel will be asked to note the contents of the report and to support the proposed areas of work identified. But is there anything you would wish to specifically bring to our attention, please?
No, I don't think so, Max. I mean, I think it's fairly self-explanatory. You can see the 3 areas of focus, some of which we've alighted on already in the People Academy report, ResDes, gender pay gap. Nice to hear, I think, from John as the diabetes lead for Actors 1, the how we're tackling health inequalities amongst our population, which is another focus of the Equality Academy, and finally the staff networks. Happy to take questions.
Yeah, no, thank you, Mel, very much. Yes, and I did note the report referring to John's inspiring presentation. So good for you, John. Well done. Thank you. Okay, so I'll just check whether I realise we're trying to be succinct as we can with some matters, but of course all colleagues have all read the papers, the updates. But I'll just see whether anything arises from that we would wish to check with Mel. And if not, may I ask if we're happy to note the contents and to support, as a board of directors, the proposed areas of work? And I think we are. I can see some nods. There's no requirement for any further detail. So no, thank you for that, Mel. That's extremely helpful. And I'll move to item 15, which is the Nursing Workforce Board Assurance Framework. Again, it's a paper, I think, authored by Jo Cam in the first place, but under, of course, your leadership. And we have some recommendations there, which is to note the actions that have been taken and to provide assurance on the provision of safe nursing and midwifery staffing during winter 21-22, which are in line with the recommended actions. But Karen, I'll turn to you and ask if there's anything in particular you'd want to bring to our attention, please.
I will be very succinct. In November last year, NHSEI produced a document that was very similar to the board assurance framework that we use for infection control, and they use that process for staffing. There should be nothing included within these papers that you are unfamiliar with, because all along the journey over the last 2 years, I think I've referred to each and every one of these bits at some point. What this does is succinctly bring it into one place. What I would stress is that the document talks through how we analyse staffing information. You will be familiar with this. How we plan to staff the wards appropriately. How we structure and process what we are doing around that, and the governance that we have in place for that. And finally, our board oversight of that. The full board assurance framework that we've completed and populated will come as a standing item at board. It will also be referred to at the People Academy as well. That can be found in Appendix C. Appendix D is the full guidance that has come out from NHSE&I, and Appendix A and B are our revised comprehensive risk assessments, which has already been through to committees, and our quality impact assessments as well. So I will stop there. I think there are no surprises in this document. It just reinforces the robust processes we have had in place throughout COVID in relation to staffing and management of staffing.
Thank you, Karen, and I appreciate the detail that's provided. I found the fill rate analysis extremely interesting in the items on governance, so thank you. Colleagues, we're being asked to note the information provided to us and to continue the interventions to support nurse staffing. So can I just check whether, does anybody require any further detail before I suggest that we unanimously do support that work and note what we'll be provided with? Is there no further information required? That's great. Okay. And of course, Karen, we noted your earlier helpful point about trying to find a way in which to manage all this data in a way that could perhaps bring us immediately to the key points. That's very much appreciated. That having said, none of us would dispute the nature of the detail that's been provided to us here. So, but thank you very much. Yeah. Okay. We're content to do that, it would appear. So that's great. Thank you, everybody. We endorse that. We'll hear more about nurse staffing, of course, in May, as Karen helpfully pointed out the thinking behind that at the beginning of this meeting. Shall we turn to finance and performance then? And I don't want anybody to feel rushed, because this is obviously important, but the excellent chairs reports really do give us the chance to get well briefed beforehand and offer the chairs an opportunity to bring to our attention what we'd need to see. A reminder to colleagues that papers 27, 28 and 29, of course, the annexes are highly relevant to this particular area, amongst others, of course, but the integrated dashboard and the actual finance and performance reports. But I'll turn to Julie, who leads us on this, and ask what we'd wish to know from the two chair reports, please, Julie.
Okay, so I'll try to be brief because you've got lots of information in the two chairs reports already. So January short meeting, just as the quality and people did, we focused mainly on Omicron. We aimed for a 30-minute meeting so people could get back to what they needed doing. We talked about Omicron and the impact on our performance, and we talked about how Omicron was different than the previous wave. So I think we've talked in the two academies what that was like. Similar conversation in Finance and Performance Academy. February, we moved to our normal time meeting, and we kicked off with, in our improvement section, the financial improvement framework. So a look at how we will deliver financial improvement in our move to outstanding across the organisation. What methodologies would we use? So Matthew helpfully took us through a paper the way we might engage with the whole organisation in how we do that. And, you know, we might not like it, but we need to live within a financial envelope. And I think as board, we've been able to leave finance on one side, knowing we were safe. We're going to get back to How are we going to do that? So we had a long conversation about what we might call waste reduction. We didn't get an answer, but you know, how could we engage with the organisation about how we make efficiencies? And that's not all about money, it's about people and it's about time. So a good look at how we might do that going forward. Performance. We went through our usual performance report, recognising the hard work that's going on across the organisation and the impact the latest wave has had on our performance. We will look back at March on what trajectories might look like as part of the operational plan and as part of the improvement report for performance. So, you know, what trajectories, where do we think we might be able to improve to? Now we've got the new wards open, so we will look at that going forward. We spent a bit of time on the financial report and the financial plan. So financially, we are forecasting a £4 million surplus. Better, well, that was in February. Matthew might update us in a minute, has that changed? But that was better than we were planning. So like I say, we've almost been able to put finance on one side during COVID, rightly so. But looking at the financial plan, we know we will be facing a challenge in 22-23. And we were talking about a gap of about 20 million. What we did recognise, lots of uncertainties at the minute, and kind of the financial planning cycle has been delayed. So again, I think Matthew's going to update us after I've updated us on what the approval timetable might look like for our financial plan and how as a board we understand it and some of the challenges we're going to face. We talked about the uncertainties around the ICS funding. We're all delighted to be part of an ICS and recognise what collaboration means and how good it is for us. But I do think we need to be cited on some of the ways money flows into our trust have changed, and we're a lot more reliant on the partnership framework and understanding across our partnership where that money should go. Ockenden was a good example of how the way that was split across organisations impacted on us. And I think the ICS, and we are the ICS, I recognise that, we'll need to understand where we are as an organisation before money is attributed to us. So there are some risks with that we need to keep sighted on and understand. So we had a conversation about that. Lots more to come on the plan. And again, Matthew's going to update us after this. So we're talking about probably a gap of about 20 million that we might have to look at. How do we work differently to actually mitigate that gap? Capital, the capital plan looks like we got a need of about 58 million and a funding of about 25 million. So, and that's not just a money gap, because clearly those capital plans are aligned to our improvement plans. So, you know, we wanted to get an understanding of what might it mean not to fund those things, and what knock-on will it have about some of the improvements we're looking at in people, in quality. You know, what might the knock-on be for some of those plans? Again, the capital plan was early days, that those numbers are being, Matthew talked us through the process that will happen in the organisation to properly understand that need and actually to be able to prioritise that need. If we have only got 25 million, which are the things we are going to do then? So that's a summary of our discussion. Next meeting coming up in March. I will pass over to Matthew and Saj to see if they want to add anything. I know financial plans on the agenda as a separate subject. Thank you.
Great stuff, Julie. Thanks very much. So, exec leads in this area, was there anything you wish to emphasise to directors, please?
Shout, Tabby, love. Tabby.
Further from my perspective, Max, to add on, that won't be picked up in the next presentation.
Thank you very much, Saj. Thank you. And Matthew, was there anything further you wish to say from the academy meetings, please? In general.
No, that's fine. I think we'll capture the main points and the risks in the next paper. Thank you.
That's great. Okay, thank you. And Julie, thank you very much for your reference to the importance of the next paper. And we can move on to that. I'll just obviously pause for a second and see whether anything generally amongst finance and performance. Clearly, a lot of it's been touched on as we've gone through the meeting so far. But if there's nothing generally, we can move on therefore and thank Julie and note the details of those things discussed in January and February at the F&P Academies. And thank you to colleagues for the compromise that was allowed in January, where we just said, look, we'll get together for a brief time and get to the key points. I'll turn therefore to item 18, which is the financial and operational plan and budget setting process. Now, Matthew's going to lead us on this. There have been some slides circulated previously, which, unless Matthew wishes to raise something specifically with us about those, I'm going to suggest we don't need to necessarily go through at this meeting, but please don't allow that to diminish anything that, Matthew, if you need to raise anything from those slides. But clearly you're asking us to note and discuss the process that's been described and previously circulated to us, and indeed we'll perhaps hear more about the planning submission group that's overseeing some of this work. So Matthew, I'll hand to you, please, and we'll get to the point of what's been asked of board here, please.
Okay, thank you. And the ask of board is just to note the progress in terms of where we are. We are submitting the draft plan this week, but the final plan that will flow through a different approval process and particularly by board will be submitted later on in April. So I'll come on to that near the end. So the paper really just provide the slides, and I won't put them on the screen, just give an indication of the process that we've gone through to allow us to submit our draft plan, but it just shows you the steps we have taken. But initially, it gives a bit of overview of what is in the plan, and that's just on the first slide. The second slide, as you mentioned, Max, we established a planning group to look specifically at what we needed to do to populate the returns from a performance, a people and a finance perspective. But there are clearly other aspects in the plan that don't necessarily ideally fall into those three categories. So we have undertaken a gap analysis of what the other asks are in the plan to allow the CBUs and corporate departments to respond to what those gaps are and how we might capture in-year monitoring and performance against the delivery of those other asks that don't fit into a normal governance arrangement. And Matthew Howson's kind of leading on that process. That's still ongoing. We haven't finalised that piece of work yet, but it will just give further assurance to the board through the academies that we're capturing everything in terms of the asks for this year's operational plan. In addition to the planning committee, we also had a specific exec overview session where each of the execs took their elements of the operational plan and just highlighted where we considered there were risks, where we were assured there was the appropriate governance and work in place, and what really were the next steps, just to make sure we had that oversight as well. So just an extra layer of assurance really to update the board on. We continue to meet weekly from a planning committee perspective. And a lot of the work we will be doing going forward now we're getting close to finalising the plans on activity that I'm sure Saj will allude to, and also on the money and also on people. It's now about triangulating those three areas. Are we all, do the numbers align to each other? You know, with the activity quantum that we want to do to deliver the thresholds, does that align to the money that's currently in the plan? And that still is work that is ongoing. You know, there's a huge amount of work that's going into just to get us to this stage, to be honest with you. So I'll just hand over to my exec colleagues in terms of the workforce submission, the performance submission, and then come back to me from a financial perspective, if that's okay, Max.
Yeah, absolutely. Yeah.
If I could just bring Pat in.
Thank you, Matthew. Anything about the workforce submission you've received?
Yeah, so we did provide a short update to People Academy at the end of February, and we'll do the same at the end of March. So in terms of workforce, obviously we have to provide a narrative contribution which is built into the Bradford District and Craven plan, which then forms part of the ICB plan. The narrative plan requirements are very much aligned to the 4 quadrants of the people plan, which have sort of pulled through the sort of key areas in the slides. We have made a draft numeric plan submission. We had to do that last week, and that will be amended for the final April submission, when we obviously have the April 22 establishment figures available. And a numerical plan is very much built on the staffing review, you know, agreed staffing reviews, business cases that have been agreed, workforce developments, etc. We have to set a number of KPIs as part of our workforce submission. Those are specifically around staff absence rates and staff turnover. In terms of staff absence, we are showing a modest improvement in year-to-date absence during 21-22, but we're not anticipating that rates will improve to pre-COVID rates, as in below 5% during next financial year. And again, in terms of turnover, our sort of January 22 turnover is 12.39%. We are predicting that turnover will increase for the next 6 months before dropping. So again, we're sort of anticipating a sort of very small improvement to sort of 11.9% by the end of March 2023. And then our plans are very much around, in terms of our narrative submission, very much focusing on retention, increasing supply, staff recovery, new ways of working, and obviously our equality and diversity plans. And the themes are very much drawn from the sort of the narrative requirement, from the sort of the requirements really in terms of the template. So that's really brief, if that's sufficient for now.
That's fine. Of course, colleagues have had the slides circulated, but no, thank you for highlighting those points. And in terms of performance and activity, Sarge, was there anything you'd wish to emphasise?
Yeah, thank you, Max. And as you can imagine, next year, the focus very much is on restart and recovery. And there's two elements to this. There's the performance measures and the activity measures that the operational planning guidance picks up on. So some of the key areas that we're aiming to achieve and deliver against is clearly the clearance of the 104-week long wait patients who are waiting to be seen. Originally, that was an end of March position, but given Omicron, the requirement is that we clear 104-week waits by July 2022. There's an ask for a reduction in the number of 52-week wait patients and the number of patients who are 78 weeks and above as well. And the requirement to ensure that we deliver against the 62-day cancer performance target by April 2022. A number of you will have already picked up on the HSJ report this morning around the reform to the cancer standards, and that is in line with what's in the operational plan. In order to assist with delivering the cancer standard, there is a requirement to ensure that diagnostics recover back, and this is a 99% target within 6 weeks. And for cancer, the faster diagnosis standard will be one of the key areas. So the 2-week wait standard will have less prominence, or in fact be completely abolished and be replaced by a 28-day faster diagnosis standard, which is focused upon a yes/no answer for patients being referred in within 28 days of cancer or not. In terms of urgent emergency care, as you'll be aware, we've maintained a very strong position, although our performance has fallen relative to other organisations. We've retained a strong position. There's some changes afoot from a performance perspective with urgent emergency care, and so we are and have been. So our visual wall and our standards that we measure against have been changing to reflect what we think the thresholds are going to be next year, and they're stuff that we report through to F&P on a regular basis. In terms of activity expectations, so a real push to reduce the number of follow-up outpatient appointments in that way to try and create capacity for new patients, and a real push for patient-initiated follow-ups where you give control to the patient being able to book and control their follow-up requirements, as opposed to just being on a routine 3-month or a 6-month follow-up period. An increase, an expected increase in the amount of advice and guidance or e-consult offers for GPs as a way of managing demand coming into the hospitals. And in terms of activity baselines for elective activity, an aspiration that we deliver a minimum of 110% of baseline activity when compared to 2019. For diagnostics, the aspiration is 120% of baseline activity. But what we're identifying and highlighting there is that because of the amount of backlog clearance work that we've already done, we believe we'll get to a position of achieving the standard and the target, but we don't think we'll be at 120% of baseline. And that's in line with many other organisations because we've already eaten into a significant amount of that backlog. So I won't go into any more detail than that. We've already submitted the draft plan that was due at place level on the 9th. And the draft activity and performance plan is then going to be from place, be submitted to ICS on the 11th. I'll pause there and hand back to Matthew.
Thank you. That's great, Sash. Thanks. So, Matthew, in order to try and pay for it.
Yeah. So at the moment, as Julie mentioned, around about a £20 million gap. The paper here says a 25.6 million, but when you take off some of the non-recurrence that we could utilise next year, it's around about the £20 million. And the key drivers behind that are the tariff uplift in terms of additional income we've got for inflation is some way short of what our cost assumptions are saying. I mean, if you take utilities as an example, there could be a step change in our utility cost. We're still doing the work on understanding how much the extra work will cost to deliver the targets, such as alluded to there, compared to the extra income that we've got in. And then there's a range of investments that we've made as an organisation, a couple of pipeline developments yet to be approved, all of which are driving the overarching gap of 25.6 million at the moment. And clearly at the next Finance and Performance Academy, we'll be going through those in detail. How are we going to close that gap? As Julie's mentioned, in terms of the overall methodology for the financial improvement plan, we will be setting somewhere in the region of a 2.5% efficiency target across all of the organisation, which equates to around about £14 million. In addition to that, we have targeted around about a 50% reduction in our current COVID costs. So I know it's around about a 35% reduction in our COVID costs, apologies, and that equates to around about £5 million. Because we do know that our overall COVID income allocation has fallen by 57%. So we haven't gone to the full 57%. We put a step change in it, and this income will continue to fall over subsequent years. I mentioned the non-recurrent flexibilities that we have. We know we've already secured efficiency of around about £1 million. And then it's now turning all our attention to restarting normal business activities that would include financial improvement and the methodology we'll use to try and extract that. Very much trying to move away from the candle end stuff, just chipping away at various little budgets. It's more about how do we engage with the whole organisation in terms of finance business partners, but other corporate business partners, looking at all the information that's out there, model hospital benchmarking, patient level costing, and packaging this up to help the CBUs in terms of what is signposted in terms of an opportunity, and then what support can we wrap around to help them extract that opportunity. We've invested huge sums in the last 2 years on capital investments in the organisation. Can we now start to explore what benefits that will genuinely give us as an organisation, both qualitative and quantitative? So it's all still work in progress with a much more detail, hopefully, by the end of March. But I will have to say guidance continues to be issued on a regular basis to us as an organisation to clarify the ask around the submission. I've captured a few of the risks on there that are already in the slides. One thing I haven't put on here is the capital position. And Julie did mention the paper that we shared at the last academy, which at the time we thought our allocation was going to be around about £25 million. It's not going to look like that now. It's going to be a lower number. They're drawing back in the additional support that we got this year, the £5 million, to get us over the line for this year's programme. So it's good. We're still in negotiations with the ICS around what that means, but the challenge to prioritise the big range of schemes that are currently on the list into a smaller pot is going to be quite a challenge. And I'll be bringing a paper shortly to exec team that prioritises individual programmes. So, for example, Mark's got quite a sizable backlog programme to be addressed. Paul's got a sizable IT programme from a replacement and new, similar with medical equipment. We're going to have to prioritise 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 in each of those, and then take a view on what can be funded next year, what may have to be deferred. But there are also wider strategic investments that will need a discussion as well. So it's going to be quite a challenging year from both an income and expenditure and a capital position next year. But clearly, so the next steps are a further update at the Finance and Performance Academy at the end of March, and Laura's helpfully allocated, I think, 30 minutes at the next board time out, which, if possible, that would be the opportunity for us to hopefully to sign off the plan before we submit it on the 22nd of April to the ICB, which will then consolidate all plans and submit that back to the centre on the 28th of April.
Yeah, that's great, Matthew. My permission was sought regarding that. I'm happy to assist with that. Thank you. Matthew, Saj, Pat, thank you very much for the quality of the briefing there, and Matthew for the heads up there actually regarding challenges to capital investment that you brought to our attention at the end. Thank you. We're being asked simply to note the progress, and that was that. You know, we're about restart and recovery, aren't we? So that was important that we heard that, and thank you for the detail provided. John, would you like to come in, please?
Yeah, thank you. Matthew, it was a question for you, and it's sort of a three-part question, so bear with me. I noted what you said about utility costs, so there's a question there about how realistic are those projections, and are they likely to be an underestimate of where we might be? You mentioned 2.5% efficiencies, sorry, as an ask across the board, as I understand it. My second question relates to that, really. Given what we don't know really about what's around the corner in terms of inflation, lack of being able to get certain things, cost of everything, how realistic do you think the budget has taken account of those unknowns? And in light of that, how realistic is it to have an ask of 2.5% efficiencies, given some of those likely ongoing and increasing pressures? Thank you.
Thank you, John.
Yes, two very good questions. In terms of the utility one, we have taken our costs up from where we currently are up to the cap level. So if they go beyond that, that clearly exposes us to further risk as an organisation. The 2.5% efficiency target, it is based on a range of assumptions. You're absolutely right around inflationary impacts in terms of the supply chain, and our head of procurement has been flagging this up, as the whole of Wyatt actually, that there are real genuine nervousness around how costs might go up just for normal products. At the moment, we've made an assumption that arrives at an overall 2.5% CIP. If it goes beyond that, you know, what we're trying to do is align assumptions across the whole of the Wyatt to say, actually, you know, we've made what we think is a reasonable assessment. If it's going beyond that, what are we all going to do collectively to try and address that problem? And it might even be something we have to do from a national perspective. They've only put so I couldn't tell you the exact number, but it's nowhere near enough in the tariff uplift to cover what we think will be overall inflation this year. And the 2.5%, John, the reason we've gone for that number at this stage is that we're asking the organisation to do something, to turn its attention back onto efficiencies. And there will be discussions around the timing at which we can turn new efficiencies on, but the capacity within the teams to start doing that, because it's still a very busy hospital. So it's not as an ambitious ask that we've had in recent pre-COVID years, when we've probably been up at 4 or 5%. But I'm trying to get to a point where I'm setting a realistic, doable target for the organisation. Clearly, we will do everything we can corporately and centrally to help and support delivery of that. But it's a balancing act, isn't it? What's the right number to go in at? What do we think is doable in 22, 23, when we're just coming out of what have been two really, really odd years from a financial framework perspective? So I didn't want to go overboard and go for 4 or 5%, because I just don't think that's doable. But is 2.5% enough? Well, it's a planning assumption at the moment, as we go through the year, we'll have a better understanding of how costs might materialise, and we might have to do something different. But yeah, it's just a planning assumption at the moment to set a target really for some of the CBUs to work towards.
Thank you, Matthew. That's a really detailed answer. John, I'll assume that you're content with the response received, yeah? I think so. That's great. Okay, thank you. Thank you very much indeed, Matthew. So, Julie and team, we come to the end of the finance and performance issues. Obviously, the ask in relation to the financial operational plan and budget setting process, which was a great session, good detail. Thank you, everybody. Is that we note and discuss the process described, and in so doing, of course, endorse it as a board, and you know, wish the team the best in taking that forward. Okay. So unless there's any requests for further information, I'll assume that we've unanimously supported that, and thanks everybody. Okay, not too much more now to go through with board. Obviously, as directors, we've kind of cleared our calendars, haven't we, till 2:30 anyway. And I know we've got some other business to deal with in closed board, where maybe some, for example, some commercial sensitivities just need to be discussed. So we've got that. So we'll make sure that we do work to 2:30 as a definite finish. But clearly, this needs another 10 or 15 minutes so that people don't feel rushed in open board business. It's all important, and I know I keep saying it, but you cannot diminish any of the debates, discussion, and detail that we've had. So thanks everybody. So in that spirit, John, I know Mel has had to leave us in order to prepare for a visit that we're having, and I think Ray may have done so as well. But of course, we do have our two deputy CEOs in John and Sarge here, and of course all of the colleagues. So thank you, John. So I turn to you then for the partnership dashboard, which we're being asked to be assured by in terms of the work we're doing in Actors 1.
Yeah, thank you, Max. And as I always say, and I make no apologies for repeating it, I think if you want to know what's going on with partnerships, you shouldn't look at an item called partnerships on the agenda. You should look at everything we've discussed today and through all of our work. So I was just reflecting on the content of the Academy Chair's feedback. In maternity, I heard about some of the local maternity system work. In the people section, I heard about the way that EDC is looking at quality, diversity and inclusion on a place-based footprint. And in finance and performance, I heard Julie say, we are the ICS. So, you know, I'm not sure there's much more I can tell you about a pie chart that offers more assurance in terms of our partnership working than what you've heard from the Academy Chairs and the executive leads. Now, having said that, I do think the pie chart on partnerships needs more work, because there isn't an academy that focuses on partnerships. And I think if we're going to say that this is the place where we bring that for assurance, I think that needs reinvigorating. It hasn't really been the time until now, but I will commit to do that. However, I hope the board will be assured on the basis of what else you've heard, that we are continuing to act as a constructive, but not supine, but, you know, an active partner in discussions at place and at ICS. Mel's role is significant. We're all involved as exec directors, and I know many NEDs will have interests as well. So I'll leave it there for questions, but I hope the board is assured that we continue to be an active partner in partnership discussions across the place and across the ICS.
Thank you very much, John. Your brevity and detail is very much appreciated there. But of course, again, directors, we've all had the partnership dashboard and an opportunity to read it, reflect on it. Was there anything that arose from that anybody would wish to further check? That's in the spirit, I think, of John's really good point. That actually everything we've spoken about today has generally been partnership work. Paul, would you like to come in, please?
Yeah, thanks, Max. Just very briefly, it's a conversation we've had at execs in the last week or two, which is, as the place-based relationships and the ICS relationships mature, a number of us are invited to take on other responsibilities. And again, I just think it would probably want to detail back for the benefit of the board at some point exactly what they correlate and correspond to, because they're the board have always been very supportive of this, but they're not insignificant when it comes to the balance of capacity that we have individually or collectively at the moment between organizational place and ICS level responsibilities.
That's a really good point, Paul, and one that I endorse completely. John will know he and I have had similar discussions regarding this, and just the recent discussion, John, about our status as an anchor institution had us thinking, didn't it, about whether we're well cited on everything that everybody's doing.
We have done some mapping of this in the past, and I think it was you who asked for it, Max. But I think, Paul, in particular, your role working across 2 trusts and for the system is kind of next level in terms of the directions you get pulled in. So it might be opportune to refresh that mapping, because there's lots of good things in that, but there are some risks, and we should be realistic about them.
Yeah, well, I think it's a really well made point, Paul, and I think I've got John endorsing that, and we'll look at the best way to undertake that work. So thank you, Paul. Yeah, and Janet, would you like to come in, please?
Just to welcome your comments about thinking the best way to present the partnership, John, because I didn't get a sense of the holistic nature that you've absolutely identified, and welcome just new insights of way that we can actually show the breadth and depth of what we're doing that may or may not be pie charts. It's just finding a way to present it in a holistic way.
Thank you, Janet. A point very well made. Yeah. Are we content to note the report, and we pick up on, just potential for additional detail and new ways of thinking? And it is in the spirit, of course, of, like Paul said, the emerging, maturing partnerships that we have both locally and beyond. So, yeah, thanks, everybody. Okay, so we'll move from partnerships dashboard to John, staying with yourself, please, for you're seeking approval for our corporate strategy and strategic objectives. Again, colleagues have had up the papers, so if you want to take us to the point that you wish us to consider, John, please.
Yeah, thanks, Max. And I'm very mindful, look, we're in extra time at the end of a 4-hour meeting, and I'm asking you to sign off our corporate strategy and strategic objectives. But I do that knowing that, A, you've had sight of all these papers, and B, I believe you've been involved actively in shaping them. And, the fact that we've reformed our strategic objectives was a suggestion that I think originally was prompted by one of our non-execs. I think we've taken full account of all the comments made of the evolving draft strategy, in particular from the discussion we had in November. We went away and reworked it. We brought it back in January. We invited comments. We got lots of comments. The appendix, which is attached, Appendix 1, lists all of the comments we received after the January iteration, how we took account of them. So the document you have in front of you is the draft strategy that we want to publish. I must say this is the long form of the strategy. We also have an easy read, which I could share actually if you wish in confidence, because we're not quite ready to publish it yet, but we've worked with Bradford Talking Media on that. So it's a much shorter, much simpler document to digest. We're also creating a series of 5 short videos which explain the strategy. So there's one each for each of the themes, patients, people, partnerships and place. And then there's a kind of overarching introductory one, which is basically Mel and Max saying, this is why we've done this and this is the kind of organisation we want to be. So we're doing those explainer videos as well. The videos will be subtitled and signed. So we're working hard on trying to make sure we get the accessibility right. So yes, I'm seeking your agreement, your ratification of this document. If you've got substantive concerns at this stage, then I haven't done my job properly, and it may be best if we take them offline, because it would bend us out of shape, I think, if we did it all today. So I'm seeking the approval of the board. The timing is an unknown at the moment, and it's been flexible. So originally we anticipated doing this at the end of March, but there's 2 or 3 things to take account of. One is there is a place-based strategy with a similar title and similar content, but not as trust focused. We want to try and align with that if we can. Second thing, obviously, is that the legal situation with the ICS has now been pushed back from a 1st of April go live date to a 1st of July go live date. So that's just worth being mindful of if we wanted to align with that. And the third thing is we've got plans for a significant staff leadership event, almost to kind of start the year, start the new ICS, reboot, post-COVID, if I'm allowed to say those words, a significant event, as part of which I know Mel was keen we'd have the new strategy and strategic objectives to really inform that reboot. the issue is the timing of that event is not yet fixed, and it might be because of the other things I've already described. We have to take a judgment about whether we hold the strategy for that event or we go with it sooner. And I'm not in a position to you today to say this is what I recommend or this is what we're going to do. I just want the board to be aware that I can't at the moment confirm the timing of this. In the meantime, the place-based strategy is having a kind of soft launch already, but they might also pick a date when we want that to happen formally. So it's trying to align 3 or 4 things, and none of them will keep still, but we'll try and do the sensible thing and make sure we get it right.
Thank you, John. That's very clear. Barry, would you like to come in, please?
Yeah, thanks, Max. Just one point. I did raise it in the last round of questioning. I find it unusual for us to have what is of necessity a high-level strategy overview document, but which doesn't carry any financials. I appreciate how difficult financial planning is in current circumstances, but other than mentioning that the financial plan is one of 12 supporting sub-strategies on page 5, we don't give any insight into our view of finances in the 5-year period to come. I just wonder whether that is appropriate in all the circumstances.
Thank you, Barry. John, what do you think?
So Barry has raised the point before, and I think the response we gave, and I don't know whether we've gone far enough to meet it, is we wanted throughout the document to be able to say we'd do what we could afford to do, and we'd be prudent, and we'd have references through the document rather than a piece that tried to do the financial analysis. Because as I've said on other things, the strategy is built up of component strategies and plans, and they are costed and they are worked through. So it's about getting a balance. We have tried to keep it high level, Barry, and I think of necessity that means we aren't trying to work through for each item and say this is what it will cost and this is what, how confident we are that we can deliver when the sums available. We do have component plans and strategies. My hope was that there'd be a bit of a golden thread in it where it was clear that we're a prudent organisation, we live within our means. If you want us to have another look at that, we will. If you want me to do a separate section on finance, I'd struggle with that. But I think we ought to have the golden thread.
Okay, I take your point and I take your stance, but do we have a 5-year financial plan? I don't recall seeing one.
I'll look at Matthew. The simple answer is I don't think so, but Matthew.
No, and we absolutely don't have a 5-year plan. We've only just really, the actual operational guidance is only really talking about a 1-year plan. We've got a 3-year allocation potentially on capital, but we don't as yet know what the outlook looks for finance. Not to stop in, to think something we should be considering when we translate the strategy into specific actions that might require business cases and service development proposals. But at the moment we don't have a longer term plan, much more beyond the 1-year horizon. We are starting the CBU business planning process again. We did start prior to the Omicron wave hitting us, and one of the asks in that is to give us your 2 to 3 year planning horizon as well. What would you expect to be seeing in 2 to 3 years? So other bits of work are starting that will give us a bit more of a sight on what we might need to be planning for financially in years 2, 3, 4 and 5, but at the moment, no, we've really only got a 1-year planning horizon.
Yeah, don't get me wrong, I understand the challenges, I understand the difficulties that we face at the present time in terms of financial planning. Page 5 of this document infers that we have a supporting financial plan covering the 5-year period. We haven't. I understand why we haven't. I just think we should be honest about that so that an external reader doesn't think, well, it talks about a financial plan, but that I'm not given any insight into what that looks like.
No, that's fair challenge to the validity of a 5-year plan. John, I think you suggested you would perhaps have a look at the text in relation to finance, how we pay for this.
Yeah. I mean, I'm not committing to start putting pound signs in, but I don't think that's the ask. I think the ask is what we do say about finance needs to be careful not to imply that there's a 5-year plan if there isn't. But I think we do need to say something about our degree of confidence that these aren't just kind of wishful thoughts, and that, you know, is realistic. In a prudent organisation, we could do this stuff. I should sit down with Matthew Horner and just come up with some wording which captures that, so it's not a gap and we don't misrepresent what we do or don't have.
Paddy?
Yeah, that sounds fine. Just I'm conscious of time, but just one question, and this is about process going forwards rather than this document. Will we have a standing board agenda item, which is strategy progress, which looks in on appropriate frequencies at the overall strategy, the 12 sub-strategies that are there, so as a board we're kept apprised of progress that is being made?
That ticks my question very well done. So, John?
So in the next board development session in February, we're going to look at a draft logic model which execs are working on at the moment. And I think that discussion should be less about the what is in the logic model, because I think we can populate that. That's not difficult, but rather how do we use it? How do we use it as a tool to support our board discussions? And I'm keen that we do that together, because it gets right to the point that Barry is making. If you do that at every single board, do you then also need all the other reports we do? What I don't want to do is invent just another report and then we duplicate it kind of threefold or fourfold. But I totally accept the point that if you're going to have a strategic direction, you say this is where we're heading, you should have touch points through the year, maybe twice, maybe 3 times, I don't know what the number is, where you say, are we doing what we said we would do? Are we on track to do that? But what I don't want to do is just add another report to our agenda on top of a fairly comprehensive set of reports we already have that says the same thing in a slightly different way. So that's the discussion. I think I'm not trying to prescribe the answer. That's the discussion I think we should have in February at board development, when we say, here's our logic model. It shows the connection between the strategy and the delivery. How often do we want to revisit that and talk about that? How do we want to use it as a board?
Yeah. Thank you. And thank you for raising that, Barry. That was actually the question I was going to ask about our review intentions. And John has committed to that, a joint decision of board colleagues. So really helpful points. Thank you.
Okay, thank you.
Yeah, thank you, Barry. Yes, yeah. And may I say, obviously we're being asked, I hope we feel able to approve this today. But my suggestion, John, was going to be just to give people a little time, that maybe you would accept any further feedback, maybe by Monday evening, close the play on Monday. Given that we're on Thursday now, just if anybody's got another query they may wish to ask for you to consider, but we can think about that. Julie, so we'll commit to that. Julie, would you like to come in, please?
Yeah, our BAF should tell us what we're doing about delivery of our strategic direction, our strategic objectives. So if we get our BAF right and we understand where there is to delivery of our strategic objectives, which academies are being managed in, to me, the work of all our governance structure should be about delivery of our strategy. So I do think I wouldn't expect to see a report detailing it, but I would expect the BAF to demonstrate that to us if we get that right.
Yeah, no, thank you, Julie. Yeah, John, does that sound reasonable? That the board assurance framework and corporate strategy should be absolutely intertwined?
Yeah, I think that's a more elegant way of saying what I was trying to say before, that we already have a number of tools and we just need to be careful not to reinvent them in a slightly different way. But, I think we need our logic model to show the connection, but I think the way that we assure progress might be through existing tools. Bear in mind, in a second, we're going to talk about the work that's going on to improve our BAF. And I know there was a discussion amongst non-execs yesterday and so on. So I think if we get the BAF right, perhaps it partly answers the question for us.
Thank you. Thank you, Julie. And thank you, John, for embracing the points that have been made. That's great. Janet, had you wanted to come in with a point, or was it dealt with?
Well, I can email. It's a minor point, John. I've raised it before because you have very kindly responded directly, and it's about the power of imagery. That's my bit of a bugbear with this one, because what it's telling me in the next 5 years is we will deliver, care through kindness and compassion, wearing masks, because all the healthcare providers are wearing masks, and I'm just wondering if that is really the message you want to say. particularly on the front cover, because it's difficult doing that behind a mask in an image. And it would be really powerful, our imagery, because not everybody's going to read even the short version, never mind the long version. Just a point.
Yeah, I hear you. We'll have to agree to disagree. I mean, I did talk to our execs about this. Specifically, I raised this point as one of the bits of feedback we received, and it's difficult. Yeah, I mean, you may be right. People may see this and may infer from it that we wear masks and we're, I don't know, a bit cold and impersonal. But right now, if you work here every day, every single person you see has got a mask on all of the time, and we are nervous about inadvertently messaging that we're back to how we were and everything's okay. We do get picked up on, I promise you, in comms, we do get picked up on images that appear to show a kind of lapse and what they're doing stood too close together. We can't win with this. You make a completely valid point, but when I discussed it with execs, admittedly earlier, so the world's moved on a couple of months, the view was, well, if we've got to jump one way or the other, we were in a position where we were thinking, do we have to put a rider every time there's a photo of somebody not wearing a mask, say this was taken pre-COVID or in a COVID secure environment? And in the end, we just said, you know what, let's have everybody wearing a mask. You clearly disagree, but that's where we ended up, Janet. That's all I can say.
Thank you. No, it's a point well made, Janet. And unless there's a tidal wave of disagreement to the images on the front cover, we'll accept that some would take a different view, but we have a decision there. Okay. Yeah, I think we do. Okay, thanks. No, very fair.
To be fair to Janet, Max, it's not just the front cover, it's all of them. I think that's the point. Yeah. Everybody's wearing a mask, and that's not an accident, Janet. So we just disagree, but that's where we are.
Yeah, I suppose I was thinking of the imagery thing of, the bit that people will see on the desks or the tables. Yeah. Okay. No, that's very fairly raised, Janet, that John's explained what the thinking is there. So that's fine. Thank you. Okay. And in the absence of any further points, may I ask that we approve this corporate strategy and strategic objectives as a board, but simply with the caveat that John will commit to considering any further feedback that there might be up until close of play on Monday, please, if there's anything further you wish to bring to his attention. And John being John, as the Deputy CEO, of course, will make sure that that's considered and consider the appropriate way to deal with any further feedback. Yeah.
And I'm going to specifically look at the finance with Matthew to get the wording right on that.
Yes. Thank you, John. Yes, I've noted the review of the wording there. Yeah, so I appreciate that. Thank you. Okay, I think we are content to endorse. Thanks very much. And we'll just move to our audit and assurance section, which asks us to consider our board assurance framework and the risk management. And then, of course, we'll hear from Barry as to anything you wish to bring to our attention with the audit committee. So board assurance framework and risk management. John, I know it's shown as yours in the agenda, but should I turn to Laura first, or do you wish to introduce something?
No, I'll go for it, and if I make a misstep, then Laura can come in and save me. So there's three things we're trying to do with this paper and the documents attached, and I'm going to assume you've had the opportunity to read through these. I'll take the papers as read. The three things we're doing is we're asking you to take a look at the latest BAF. I don't mean the latest format. As you all know, it's being refreshed. It's the traditional format you're used to seeing. I just mean it's the latest content that's been updated. The assurance levels for each of the strategic objectives remain unchanged. We are working on a refresh of the BAF. I know Ned's had a discussion yesterday. This will be a topic for board development on the 14th of April. So that's where we've got to with the BAF in terms of the content this month and the ongoing development. You've also got the high-level risk register and movement log. As the cover sheet explains, this has been through the executive team and through the academies, which reviewed in January and in February the relevant risks. And so the updates we've already received in this meeting from the academy chairs include anything they felt they needed to escalate in respect of risks. There are no exceptional items from those discussions for escalation today. And the third thing we're asking you to note is an update on the review of risk management strategy. Our aim ultimately is to bring to board in May a definitive version of the BAF, so we'll have had a development discussion before then, and also the update on risk management, the risk management strategy. There is a specific question in there about whether colleagues agree that we ought to take the strategic risks from the BAF routinely through the academies. And the executive team's view is yes, that makes sense. I think there was a suggestion actually that may have come from one of the academies. So yes, we support that. We think that's a good idea if the board is minded to agree that we would do that. So I'll pause there, Max, and answer any questions anybody may have. And Laura will help me as needed.
Thank you. Thank you very much, John. On the point of the relevant board assurance framework risks going through academies, that was very much part of our discussion on Tuesday, and I'm pretty sure there was unanimous support among non-exec directors that that's exactly where those matters should be discussed. So unless anybody wants to correct me, I heard that clearly in the briefing we had on Tuesday. So we're being asked to review the BAF and decide if the level of assurance indicated for each strategic objective is appropriate, the actual BAF itself, to note the high-level risk register, to note the update in relation to the review of the risk management strategy, and indeed to endorse the fact that academies need to hear about relevant BAF risks. Does anybody wish to raise anything for question or consideration? And have John and I hopefully articulated correctly what's being asked of the board in relation to the framework and risk management?
And there's a wider point, if I may, Max, which is when we have those further discussions we've described in development board and so on, it's an opportunity to pick up some of the feedback I think I picked up from your discussion yesterday. This is less about what's in these tools. I think we can get that right, the format of the document, making it a bit simpler, more accessible. It's about how we use it, how we properly embed it into our thinking and our working, because I think we would all accept there's probably a better way of using this as a meaningful control tool than we've managed to date. We all accept that. We now need to do that, and I think that's the discussion we need to have in March, April, and May.
Agreed. That's John. That's something I'm looking forward to in the development of this, that we can use the board assurance framework to frame many of our discussions. So yeah, thank you for that, John. Yeah. Okay. So I don't think there's any further questions. Again, I know that John and Laura will receive any feedback you wish to make during the course of this afternoon or anything. But we've all had the papers, we've seen where we're going. And John, may I just emphasise the desire of the non-exec directors to see academies really focus on much of this assurance framework and risk management stuff. So, which seems absolutely appropriate, of course. They are developing into really, really strong forums, I'm sure. So, yeah, okay.
Thank you.
Thank you, everybody. Yeah, that's great. That is unanimously supported, John. Thank you. And Barry, I'm conscious that it's often, as I come to you, we're getting right at the end of things, but that doesn't matter if there are things you wish to bring to our attention in relation to the Audit Committee report 1st of February. It's there for us to note, of course, but anything you'd wish to emphasise, please.
It'd be inappropriate for me to say anything about leaving the best till last, wouldn't it?
No, absolutely not. You're right.
Seriously, though, the report that I've written, I can confirm to board that it highlights all of the key matters that arose in the recent meeting. I'd like to treat it as read, and I'm happy to handle any questions that people may have.
Thank you very much, Barry. So, colleagues, have a chance to look at the work of the Audit Committee under Barry's leadership. And is there anything you would wish to raise, anything you would wish to know more detail of, or indeed to suggest to Barry that they might consider? Are we content with what's being done there? Yeah, I think we are. Yeah. Thank you very much indeed, Barry. That is noted by board. Thanks. And then our final item, given that there was no other business, was for Matthew to seek our approval relating to the reservation of powers to the board and scheme of delegation and standing financial instructions. So I will turn to you, Matthew. I can see that the recommendation on the paper is to approve the updated standing financial instructions and scheme of delegation. Again, colleagues have had a chance to read the paper. Matthew, anything you want to point out particularly, please?
Just to say we're genuinely saving the best to the last on this one.
Very good.
Just a couple of points really. So It's been through audit committee and been approved by audit committee, and it just covers a number of areas of tidying up. It covers just aligning to the new CBU structure in terms of delegated limits, aligns to the latest accounting standards, particularly when you look at leasing, and aligns to new public contract regulations. So it's just an overall tidy up really to reflect latest legislation, but internal governance arrangements as well. So yeah, it's just brought here today for approval, if that's okay. Thank you.
Thanks very much, Matthew. There was just a couple of typos that are under the urgent matters in the absence of the chief executive. May I ask that's just tidied up, please? Maybe it's already been done and I have I've printed off a copy with a couple of typos, but that's fine. It was nothing urgent. Okay, again, colleagues, let's not rush something as important as this. If there's anything that anybody wish to raise or inquire in further detail about. Do people understand the report, and are you content to approve those financial instructions and scheme of delegation with the updates that are there? Don't think any further details required. There are no hands raised. Can I take it from that we unanimously approve? Yeah. Thanks very much, everybody. Okay. So that's all done, Matthew. Thank you for bringing that to our attention, and that is unanimously approved by board. Have we anything that's arisen as I close this now that people thought, oh, we need to pick that up for a particular board, committee, forum or academy or elsewhere? And indeed, in the spirit of Sarah having been with us, certainly having been with us, I think it is, was there anything that anybody thought, you know, we need to do some comms on that? So just pause for a moment and just ask if anybody's picked anything up there that wasn't already mentioned or actioned that they'd want. I think not. I think we've obviously dealt with an awful lot of business today, but some terrific briefings as well. I think whilst I wish it was more of a conversation sometimes, of course, I think the quality of the briefing we've all received and the raising of the knowledge collectively has been terrific. So thank you, everybody. I'm going to close this meeting now. Of course, we're going into a closed meeting, but just stay with me for a second before you drop off this call, and I'll ask Katie to close the recording of this now, because this is obviously what goes into the public domain before we deal with any, well, there's some minor